Vernal keratoconjunctivitis speed revision. Okay, so let us start. First, vernal keratoconjunctivitis is also known as spring catarrh because of the springy, ropey discharge that it has. It is a bilateral condition and it is a recurrent condition. The typical history that it is a boy who is in a teenage. Usually, summer season is where the boy has this problem, and the type of hypersensitivity is type 1 type hypersensitivity reaction, and we know it is IgE mediated. Also type 4 hypersensitivity also plays role. Now there is spontaneous resolution of this condition at puberty. The boy also has intense itching, eye rubbing, which is vigorous, and ropey stringy discharge. So the typical history of a boy: summer season, recurrent and bilateral, including the intense itching, eye rubbing, and you will see ropey or stringy discharge. All these will point towards diagnosis VKC or spring catarrh. Now you look for some signs which are also particularly important MCQs. Number 1 is honor Tantar's dot. So as I've drawn, these are present at the limbus, and these are gelatinous nodules which are present at the limbus. Honor Tantar's dot. They are composed of eosinophils and epithelial debris. Number 2, palpebral form of VKC has cobblestone or pavement stone appearance. So as you raise the lid, you will see that palpebral conjunctiva have this form of prominent papillae. Papillae is epithelial hyperplasia, and this will give the stone that are arranged in a specific arranged form, that is cobblestone or pavement stone appearance. Between this cobblestones, that is papillae, there would be discharge that would be arranged, that would be coagulated, which is known as Maxwell-Lyon sign, which is also very important to remember. Okay, so Honor Tantar's dot, cobblestone appearance, Maxwell-Lyon sign. Now, as the name suggests, vernal kerato means cornea. Cornea is also involved. In cornea, we see shield corneal ulcer, means it is shield shape, which is known as shield corneal ulcer. Now, because of the papilla that is present in the palpebral conjunctiva, every time the patient will close his eyes, it will rub the cornea. This will cause this type of ulcer. Also, because of there is repeated rubbing, what happens is the patient has thinning of cornea. Thinning of cornea will decrease the strength of cornea, and the patient will have bulging cornea, which is also known as keratoconus. Because the keratoconus is because of some other reason, it is also known as secondary keratoconus, because the cornea has become thin. Okay, so that is it. Now one more thing in the cornea is pseudogerontoxin, which is the subepithelial scarring. Okay, pseudogerontoxin is basically also known as Cupid's bow, because it also looks like a bow. Fine. Then basically pseudo means false, geron means old age, and because this scarring is seen usually normally in old age people, but when it is seen in younger age like a teenage boy, it is also known as pseudogerontoxin or Cupid's bow. Okay, now this were all the signs that you can see: Honor Tantar's dot, cobblestone appearance, Maxwell-Lyon sign, shield corneal ulcer, secondary keratoconus, pseudogerontoxin. Management simple, because it is a hypersensitivity reaction. Will give topical antihistaminics and mast cell stabilizers. Because this is IgE mediated, will focus on antihistamine and mast cell, which release this histamines. Okay, now a drug which has both these properties is olopatadine. That is why it is the drug of choice for the VKC. Okay, now other drugs which can be used are low potency steroids, that is lotiprednol, fluocinolone, and topical immunosuppressants like cyclosporine and tacrolimus. Okay, so that was all about VKC, and hope it was helpful. Thank you.